Welcome to this presentation on a career in speech and language therapy on behalf of the Speech and Language Therapy Department at Galway University Hospitals. In this presentation, I hope to give an overview of what a speech and language therapist does, where we work, and how to train as a speech and language therapist in order to help you get better insight into what the job involves. This presentation can be watched in conjunction with our other Galway University Hospitals information overview video on careers in health and social care professions. Let's get started.
So what is a speech and language therapist? Well, this definition provided by the Irish Association of Speech and Language Therapists provides details on the expansive role we have in helping people and the range of specialist skills and knowledge needed in order to carry out this work. Speech and language therapists, or SLTs, assess, diagnose and provide a broad range of interventions and support to people across the lifespan with a variety of disorders and/or concerns regarding communication, voice, feeding, eating, drinking and swallowing, otherwise known as FEDS. So this means speech and language therapists are the professionals who help people with communication and swallowing difficulties, and we do this work with people of all ages, from birth to the elderly and everything in between.
To understand this broad definition of the role of a speech and language therapist better, we need to break down what communication and swallowing are into more detail. Let's look at communication first. Communication involves both speech and language. Speech refers to the production of sounds. This is a motor movement, so like any other body part movements, it involves accurate and coordinated muscle movements. Language then is a cognitive or a thinking skill. It involves comprehension and expression of a spoken, written or other symbol-based system. Humans understand spoken words when we listen, and we can produce words when we speak. We also have the ability to understand and produce written symbols when we read and when we write. Looking at speech and how we produce sound can help understand when a person might need our help. Articulation is the way we produce sounds by moving the lips, tongue and palate. Sounds are shaped by very precise movements of these structures. Any slight misplacement or any change to the structure itself will make a significant difference on what is heard, where the sound can become slurred or can even become distorted and very difficult to understand. Voice is achieved by the movement of our vocal cords meeting together and vibrating to produce sound. Any disruption to the structure or movements of the cords can make a significant change to the quality of the person's voice. Voice changes mean that an individual can sound more hoarse or breathy. The pitch or tone can be strained or excessively high or low. In fact, the individual may be unable to produce any sound at all, depending on the impairment. Fluency refers to the rhythm of our speech. Difficulties in this area are most commonly associated with stammering, where the person can repeat sounds or parts of words. Language is a cognitive or a thinking skill. Language has a number of components which we acquire through many years of childhood development. Looking at these components can give an idea of what happens when somebody has a difficulty in the area of language. Our speech sound system is first. While the human vocal tract can produce a large number of sounds, as we acquire language, we develop an understanding of the corresponding sound system to that language. This means we learn to understand and use speech sounds correctly within the language we are speaking, and we do not use ones that aren't in that language. You might know some sounds that we use when speaking Irish or other languages that aren't ever used in English. Difficulties arise when the speech sounds patterns being used have not developed fully, and this is very commonly seen in children. Vocabulary is our knowledge of words, what they mean, and how to put them together when talking. Grammar is the rule system that enables us to change the meanings of words, for example by adding endings. It enables us to construct sentences of greater complexity by changing tenses or using complex words that by themselves don't carry much meaning. A reduced vocabulary or difficulties with using grammar will limit what the person can express. Think about the difference between a young toddler speaking when they may only combine one or two words, and compare that to the very complicated sentences that adults can produce. So, the developing child with a language impairment can need our specialist help to acquire or develop their language skills to the best of their abilities. For someone who has had an illness or an injury, they can lose their language skills and they need our help to retrain and rehabilitate them in order to be able to communicate better. Finally, our social communication. This is our non-verbal language abilities, for example things like facial expression and eye contact. As humans, we can say a lot without ever saying anything at all. We do this because we have developed social communication skills. We can change our facial expression to show our emotions. We can use eye contact to engage in others while not making them uncomfortable. We can stay on topic, or we can move from one topic to another without losing our listener. And we can understand meanings that aren't actually meant literally. These are all important skills in human interaction, and difficulties in this area of social communication are commonly associated with autistic spectrum disorders. Now moving on to swallowing. Feeding, eating, drinking and swallowing is another area which speech and language therapists have expertise in. The ability to eat, drink and swallow safely requires motor, sensory and cognitive skills, similar to our speech and language skills. These can be affected across the lifespan for a variety of reasons also. The speech and language therapist is trained to assess, diagnose and manage FEDS difficulties. This can involve conducting an instrumental assessment of the swallowing, using X-ray or by placing a scope. The image on the left shows a swallowing X-ray picture, and the image on the right shows the vocal cords being viewed through a scope. These assessments are typically done in a hospital setting and help the SLT make a management plan for the individual with swallowing difficulties. Swallowing can also be assessed using clinical skills and observation of feeding, for example with very young babies. So as a trained speech and language therapist, you are able to help people with communication and swallowing difficulties in many different areas. The work might look different depending on the setting or the age group you are working with, but the principles of the work remain the same and the skills are transferable. Here we looked at a number of different client groups the speech and language therapist works with. For some areas, the therapist is working with the individual or their families to help them develop new skills and improve their abilities. For other individuals, the speech and language therapist is helping regain lost abilities in rehabilitation. And sometimes the therapist is helping someone compensate for an impairment so that the person can participate better, for example, when they're interacting with others. Almost always, the speech and language therapist is working as part of a multidisciplinary team with other professionals. So let's look at who speech and language therapists work with. We work with people with intellectual disability, for example, Down syndrome, people with progressive illnesses, for example, Parkinson's disease, motor neuron disease, children who are typically developing but who are presenting with speech and language impairments, neonatal or premature babies with very early feeding difficulties, people with hearing impairment, including children with cochlear implants, children and adults who have had a sudden loss of communication and swallowing through illness, for example, stroke, brain injury, children with cleft lip and palate. This is a congenital condition, means somebody is born with this condition. With a cleft palate, there can be an opening on the roof of the mouth into the nose, and this presents with significant challenges for speech articulation and for feeding. Speech and language therapists work with people who stammer, with people with physical disability, for example cerebral palsy or complex needs, critically ill patients who are in the intensive care unit with tracheostomy or breathing tubes, people with autism and other neurodevelopmental differences. We work with people who are unable to speak, for whom an alternative communication system is needed. People who have cancer, for example head and neck cancer. Some of the cancer treatments of surgery or radiotherapy make changes to the structure of the vocal tract and results in difficulty in communication and swallowing. We work with people with dementia and people with mental health difficulties impacting on their communication and swallowing ability. Let's look at this video, which gives some insight into a speech and language therapist experience of working over many years.
My name is Phoebe Kent and my job title is Head of Children's Speech and Language Therapy at Royal Wolverhampton NHS Trust. Well, my job is managing the service at Wolverhampton, but for speech and language therapists generally, there is no way to describe a typical day because there is such a wide variety of things that you can do. You can be working with adults that have had a stroke or children on the neonatal ward who are premature birth children who are having difficulties feeding and swallowing and everything in between. have to have a degree in speech and language therapy. Now that can either be an undergraduate degree or a postgraduate degree, and obviously to get onto the degree course you need to get the required A-level or equivalent results, which vary depending on which university you are attending. Being able to communicate with a wide variety of people is one of the most important characteristics, because we might be working with little children, you'll be working with their parents, you'll be working with teachers, working with a multidisciplinary team which could include physiotherapy, occupational therapy, doctors, nurses, across the board. So those sort of skills are very important. The sort of things that you study as a speech and language therapist include language and linguistics, medical studies, social sciences, and a huge range of different areas. It's quite exciting in speech and language therapy because you qualify as a newly qualified speech and language therapist, and you are qualified to work in any area of adults or children's speech and language therapy. Usually what people do, they come out of university thinking, I want to work in that area. But once they've been qualified for a few years and had a bit of experience, then they get more interested in a particular route and tend to go down that route. So for me personally, I always wanted to work with adults as a speech and language therapist. When I qualified and had my first job, I realised I wanted to work with children, and after a few years I realised that I wanted to work particularly with children with autism spectrum disorders. And then after a number of years doing that, I decided I wanted to go into management and do the broader, more strategic view of speech and language therapy. So people can really change in their careers and move into different areas. Job satisfaction within this career is immense, because what we do all the time is try and support people with a wide variety of difficulties, and those difficulties, as I say, can surface from a variety of different causes. So every day you're aiming to make people's lives better and improve their quality of life. So that is very satisfying. Pay within speech and language therapy is dependent on how much experience you have, how long you've been working, and also the level of speciality that you have. So for some members of staff who've done lots of additional training to work with eating and drinking difficulties, their pay will increase alongside the roles they get with that. The thing I love most about being a speech and language therapist is that no 2 days are alike. Every day is different. I meet so many different people from all walks of life, and it's just great fun being able to help people that really need us.
So what does a speech and language therapist do? Well, when an individual is referred to speech and language therapy, we begin by gathering some background information. We will review the individual's medical history, or for children, we'll gather information about their developmental history, and we will review other professional opinions from our multidisciplinary team colleagues. So these might be professional reports prepared by another discipline, for example a psychological report or a dietitian report. The types of reports or the professionals will depend on the setting or the client group that you're working with. We'll then listen to the person's description of the problem. This might be the person themselves, the parent, or a family member. We try to establish what their concerns are and what their priorities are to work on. Once we have a better understanding of the presenting problems, then we conduct a thorough assessment. So for speech, we'll assess articulation, voice and fluency. For language, we look at comprehension skills and expressive language skills, or we'll do a feeding, eating, drinking and swallowing assessment. Individuals can present with needs in a single area or a combination of these areas of speech and language therapy. The next stage then is to develop a therapy plan. This involves goal setting with the individual and preparing programs which have a strong evidence base. Therapy plans might involve providing specialist advice, developing specialised programs to work on certain skills or rehabilitation, and typically therapy programs have a time frame for review. Typically we're working with a multidisciplinary team for the ongoing management of the individual at the same time. The therapy plan might be delivered intensively depending on the setting. An intensive therapy is where you get to see the individual multiple times in the same week. Therapy might be delivered on a weekly basis, for example for a set number of weeks until there's another review scheduled, at which time you will reassess and reset goals. And finally, the speech and language therapist might be providing a consultation service, and they might be providing advice and might need to liaise with other speech and language therapists who are involved in the patient's care and work in different settings and services. So where do speech and language therapists work? Typically, speech and language therapists are healthcare based, working in, for example, community clinics where the person will attend from home to receive therapy, or working with patients who are admitted to hospital. After discharge from hospital, some patients need to attend rehabilitation centres to continue recovery, and speech and language therapists would work in those centres as part of a multidisciplinary team also. Speech and language therapists can work in nursing homes and can also deliver care in the person's own home, which is called domiciliary care. Another big cohort of workplace is the disability services, and speech and language therapists work with many of the organisations to help people with intellectual or physical disability. Speech and language therapists continue working as a multidisciplinary team in these settings, which often involve working with individuals with complex needs. And so there will be close liaison with our health and social care professionals like occupational therapists, physiotherapists, dietitians, social workers. Speech and language therapists can also work in schools and in preschools. In these settings, the speech and language therapist might be based in a mainstream school and work closely with classroom teachers, resource teachers and psychologists. There is a common theme of being part of a multidisciplinary team, and the disciplines that the speech and language therapist will work with depends on the setting. So a hospital-based setting might involve close work with nurses and doctors, as well as our HSCP colleagues, while the educational setting might involve closer work with teachers, SNA and psychologists. Many speech and language therapists also work as individual practitioners in private practice. Many speech and language therapists will work in blended settings. For example, they might be classroom based in the morning or on certain days and work in clinics in the afternoons or on other days. There is a wide variety of settings, and the speech and language therapist might move through some or all of these during their career, or choose to concentrate and focus on developing specialist skills in a single area. Some speech and language therapists will move on to third level education, working in research and in the training of undergraduate speech and language therapists. Speech and language therapists will also work in management roles as heads of speech and language therapy departments, or work at service planning and service development. Continual professional development, or CPD, is a requirement of our professional registration as a speech and language therapist, and all SLTs will engage in lifelong learning to ensure their practice is up to date and evidence based. So what does the training to become a speech and language therapist involve? Well, students will be taught some science-based subjects, including areas like human anatomy, physiology, then behavioural sciences and psychology. Students will learn about how language is acquired and the study of the foundation of language and sounds in linguistics and phonetics. The students then will move on to some specialised subject areas. They will learn about the theory, assessment and treatment approaches in communication and swallowing, with an emphasis on evidence-based practice. Students also undertake a research project and learn research skills, and they learn other generalised skills for the workplace, such as professionalism, communication, problem solving and teamwork skills. Woven throughout the course is clinical placement and clinical practice. Students get experiences of face-to-face working with clients in various different settings. These placements can take place on site. So for example, at the University of Galway there is a small HSC clinic within the university campus where students work with clients under the supervision of their clinical tutors. External placements in various speech and language therapy workplaces such as hospitals, clinics and classrooms also run for a number of weeks throughout the course. Clinical placements are organised by the university and can take place anywhere around the country. These are unpaid placements, and these are a requirement for the professional qualification.
Training to become a speech and language therapist involves obtaining a professional degree. This can be a recognised undergraduate or postgraduate qualification. In Ireland, undergraduate programmes are run by University of Galway, Trinity College Dublin, University College Cork, while the University of Limerick have announced a new undergraduate programme starting in September 2026. So please visit the university websites for details on entry requirements. UL also have an accredited master's programme running, and it's important to know that pay scales for graduates entering the profession will be the same irrespective of whether you obtained your qualification coming through the undergraduate or postgraduate route. CORU is the regulator for health and social care professions, including speech and language therapists, and all speech and language therapists must be CORU registered in order to work in the Republic of Ireland in either public or private practice. In Ireland, graduates from the professional training courses within the state are automatically eligible to register with CORU after graduation, as CORU accredits those courses. And this is an important consideration for individuals who are considering studying abroad, including Northern Ireland and the UK. All graduates who obtain their professional qualification outside of the state must have their qualification assessed and approved by CORU in order to work in Ireland as a speech and language therapist. So CORU is the body to approach for queries on the recognition of international qualifications and to find out more about their approvals process. Another important consideration for those considering training abroad relates to FEDS training. FEDS, feeding, eating, drinking and swallowing, we discussed earlier as being part of the speech and language therapist role. And this is a requirement for CORU registration to practice. And here in Ireland, all accredited training programmes include FEDS training, but this is not always the case outside of Ireland. Elsewhere, an individual might have to obtain specific FEDS training on completion of their professional degree in order to be eligible to work in Ireland. This training will involve a theoretical and a practical component. So when looking at FEDS training, the individual will need to consider how the practical component will be achieved, as this will involve placement hours which can be difficult to obtain. So it's really important to consider where these placement hours will be attained, as well as the postgraduate FEDS course itself, and then whether together this will meet the requirements of CORU for registration. So this information should all be part of your research into studying abroad options.
I hope this presentation has given you a clearer understanding of the speech and language therapy job, where we work, who we work with, and how to train to become a speech and language therapist. These websites are helpful for obtaining more information on careers in speech and language therapy and more about the work we do. There is the Irish Association of Speech and Language Therapists, the Royal College of Speech and Language Therapists, and the American Speech Hearing Association. And finally, to remember, CORU is the body to approach for any information about recognition of international qualifications, which is an important consideration if you're thinking of training abroad.